The topic of our webinar today will be focused on the intersection of return to work and chronic care strategy, most notably diabetes and mental health. Employees with diabetes and mental health issues have been especially susceptible throughout the COVID pandemic. And for the year ahead, they have unique challenges to confront, major lifestyle changes as work transitions back in person. So how should benefit leaders develop an inclusive and personalized healthcare strategy so that no one is left behind? We think that much of it is about guiding the right people to the right healthcare solutions. We're excited to explore more on this topic today. We'll start with an overview of the Virta Accolade partnership and how our partnership model helps fill in those care gaps by connecting patients to the right care. Then we'll dive into diabetes and mental health strategies specifically, and some advice that benefit leaders can take and apply today. Then we'll turn it over to the city of Fort Worth to share a case study of how they were able to support their employees and also achieve financial and clinical improvements in their population. Joining us today, we have Trent Myers, National VP of Sales and Alliances at Virta Health, Dr. Greg Burrell, VP of Clinical Solutions and Associate Chief Medical Officer at Accolade, and Nathan Gregory, Assistant Director of Human Resources at the City of Fort Worth, Texas. And with that, I'll hand it over to you, Trent, to kick off our presentation about the Virta Accolade partnership. Thank you, Trent.
Thank you, Sarah. Really appreciate it. My name is Trent Myers. I'm responsible for field activity here at Virta. One of the things that we're going to do is Dr. Burrell and I are going to talk a little bit about the Accolade partnership. I'm going to summarize a survey we did with some of our patients around this particular topic and briefly introduce Virta in a very short amount of time. So with that, I'll attempt to get started. If you'll go ahead and advance the slide. First of all, the Accolade and Virta partnership from a patient's perspective. That's really what we're here to do. And the Accolade is a high-touch benefit navigation and advocacy system. So somebody who's walking them through their care journey. And Virta is a point solution for high-risk individuals, specifically around diabetes. So the benefit really is meeting members where they are. If they call in and they have questions about a particular service, tying them directly to a solution like Virta with someone who's entrusted with their care. So navigation, advocacy tied to a solution helps us not only increase engagement, but get the right patients in the right care at the right time. Next slide. From a employer's perspective, there's benefits as well in the partnership. A couple of them are administrative. So it's a streamlined contracting mechanism. There was an explosion of vendors doing wonderful things in the market 5 years ago, but it's difficult to partner with all of them directly. Through the partnership with Accolade, if there's an Accolade customer that's interested in a diabetes solution, it's an amendment that can be provided to their existing agreement versus having to go through direct contracting with Virta individually. We have patient targeting. So if you think about Virta, and we'll talk a little bit about how it works in a minute, but where there's a lot of education about nutrition protocols in reaching members about the advantages of a solution like Virta, but there's data that Accolade will have that can help with the patient targeting to increase that engagement, which gets more people on the program, helps save more lives, and saves companies more money. There's also aggregated reporting because it's an integrated solution. And as you'll see later in the program, there's more people in the service, which generates more ROIs for the companies that adopt both. With that, Greg.
Thanks, Trent. As Trent was just talking about, really we do we really have kind of worked tirelessly over the last several years to hone in on this kind of process by which we help to work with partners, work across a group of partners to be able to really direct people and navigate them in the right way. And it kind of starts, on the left with really thinking about how do we find people that we think and we know need help the most, that may not know that we're out there, that are struggling with something, whether it's a mental health condition, physical health condition, both, helping to find them at that time or earlier as that might be coming up. Really kind of getting them tucked into the system, starting a conversation with them, being that kind of trusted voice and first point of contact, doing that assessment to see what's going on, what are the challenges that they're dealing with. Let's say, for example, somebody with diabetes, is it the cost of medications? We all know that could be that insulin has gotten significantly more expensive than previously. Is that what's going on here? Are they not as sure about why they're taking the meds and the importance of taking them and what they're doing for them? And so, they've stopped with some of them and they want to, understand the use of them or perhaps get off of those medications altogether with a diet-based strategy. Or do they have other, things that are going on in their lives that are blocking them? Social factors, psychosocial factors, things like depression or anxiety. And so, really helping to kind of meet everybody at the beginning and be that first point of contact, and then based on really their unique circumstances, helping to direct them to the appropriate thing, whether it's a pharmaceutical savings partner, whether it's over to Virta specifically to help think about getting their diabetes into better control and potentially considering reversal, or whether it's to think about that kind of really truly going down that collaborative care model to say, let's focus on both their mental health condition and their physical health condition to simultaneously make both improve, and thinking about integrating that behavioral health into kind of all that we do. So really that's how we think about our partnerships, and how we've formulated this one with Virta as well.
So we're here to talk today about how it applies to return to work. Much of it's about guiding patients to the right solutions at the right time. That's really what the partnership's about. But the other things that it really unique to this situation is, one, those with chronic conditions are especially vulnerable. Number two, how as benefit leaders can we develop an inclusive and personalized healthcare strategy so nobody's left behind? And to set the stage and illustrate the issue on the chronic condition, specifically with diabetes, 6 out of 10 Americans struggle with chronic metabolic disease, including diabetes, pre-D, and obesity. There's 35 million people that have diabetes in America right now, and it's continually increasing. And there are 88 million people with prediabetes that without an intervention program will make that 35 million a much larger number. So the return to work transition is going to change how people work. Those with type 2 diabetes especially, it could be a lifestyle shift because they depend on the routines to stay healthy. And anyone living with diabetes, whether working from an office or at home, could use extra support from their employers. So we did a survey of our patients. We understand our customers, we understand the integration with our partners, but those folks that are at home that had a strange year last year, we conducted a survey and asked them, what are the top 3 things that employees with diabetes wish that their benefit leaders knew about return to work? And so we'll talk about the top 3 findings and then a little bit about Virta. And number 1, it may seem obvious, but really it's just to stop and think about the impact of returning to work, especially for those with chronic health conditions. So one of our patients, Virta, here talked that she's comfortable about the safety and the gradual return to work, but quite frankly, she's concerned about maintaining her schedule, and it has a little bit of anxiety around it. In general, kind of the summary that we took from this was keeping your vulnerable population in mind, What are their needs? What can we do to accommodate them? Is there enough flexibility baked into the guidelines so they don't feel like they have to compromise their health in order to return to work? So in addition to the things that HR leaders are constantly talking about right now with taxes and logistics and distancing and safety protocols, to also think about those with chronic health conditions as they return to work and had a year away from the workplace. The second thing we heard was a request to have diabetes-friendly food options. So changing the working environment is going to have a direct impact on the lifestyle choices. You know, Verna, that we talked about on the prior slide, confided that being away from company lunches made it easier to make nutritious choices. Jim was a patient that has actually never met his coworkers in person. He started in the pandemic when everybody was remote, but he does have a personal battle with diabetes. And while he's excited to meet his new coworkers, has some apprehension about going into the office and maintaining, you know, his diet regimen. And so what he hopes that there'll be nutrition options that are friendly to him. And I think the quote when we were talking about the impact of diabetes, where Jim Carroll, who's the CEO of Diatribe, he suggested that we have a sub work group on that HR front that's talking about return to work, to talk about, you know, helpful ways that we can have bring these people back to work safely and make sure that their needs are met. The third item that we heard was, you know, really just the importance of the right wellness resources and the right strategies to take care of remote population. So we had a big spike last year in customers signing up with Virta because remote care of high-risk individuals with physicians was a very, very important topic, and it continues to be so. So now it is a must-have conversation with people that probably shouldn't be going into clinics or a doctor's office at the pace that they were before. But how do we maintain that? And how do we make it available to a broader audience was a request. Here, Lori is a patient at Nielsen, and she talked about how empowering and life-changing the Virta treatment has been for her specifically. So in a minute, I'll talk about, you know, more about what Virta is, but really it is the wellness strategies, Virta, Accolade, and those that are available to any high-risk individuals that are dealing with a chronic condition in the workplace. Virta in its simplest form is nutritional therapy combined with advanced telehealth to take care of those with diabetes. It's the first and only medical treatment clinically proven to reverse type 2 diabetes. And reversal, by definition, is returning that patient to a subdiabetic A1C level of 6.5 and also removing the diabetic medications. And the way that we do that has a technology element, a nutrition protocol, coaching and providers to walk the patient through the program. And it starts with the patient in a nutrition protocol that's based on low carbohydrate approach. We've been cited in the American Diabetes Association for the last 3 years in the standards of care as a first-line therapy for type 2 diabetes, but adherence to that has to start with the patient, with religious preferences and access to food and what is their day-to-day work life like. Are they on the road? Are they truck drivers? Or do they have access to, you know, fresh fruits and vegetables? We take this into account before we start the program, ship all the durable medical equipment to track these devices, and then use physicians to titrate the medicines down when their blood sugar comes under control. So this comprehensive process, we provide all as one bundled fee, and we do it to those patients, and that's what we call reversal. The results that we see across our book of business are really powerful. And the clinical trial that we just finished, it's a 5-year running clinical trial, but the clinical trial at 1-year results mirror the book of business that we see now. There is a cost savings component. The fact is these drugs that the patients are on are very, very expensive and are a top 5 cost typically for employers that we work with. Not to mention, there's really bad side effects on being on all these medicines to manage the diabetes condition. And then the people that enter into the reversal program, we found that 60% of those actually do achieve that reversal that I defined on the previous slide. And the 40% that didn't reverse oftentimes have more impressive results. They may have started an uncontrolled, A1C of a 13, and you can imagine bringing that patient down to a 7 or an 8 and having their metabolic life completely change and they feel better than ever, achieve the biggest results. It just takes time and don't fall into that specific category. Next slide. And the Virta Solutions, if you'll build this out, what we started with and what we're known for is diabetes reversal. But there was a concern from the employer population that they want to address the whole spectrum of health. How do we address that 88 million in prediabetes to keep them from going into, into diabetes as a category? And can you take care of them? And I don't want to have to communicate 4 different solutions to my population, one to address obesity, one to address prediabetics, one to address type 2 diabetics that are on diabetes management, and then reversal. And so we've expanded our offering so that we can be that one solution for the metabolic health journey, to where it's a virtual clinic that the patients, where they are in their journey, we will put them into the right program. So it does cover obesity, does cover the prediabetes reversal and reversal that I was describing on the last 2 slides. And those that have type 2 diabetes that are not yet ready to do the reversal program, we have diabetes management that we've added, which is unlimited strips and meters and all the equipment that you would need, as well as monitoring, with the change that we educate these folks on the impact of nutrition on blood sugar and have nudges, with the goal being, if you're an employer, you have one vendor to communicate. From the patient, how many people can we get into reversal to increase the impact that we have on a population? So I covered a lot there. And with that, I'll turn it over, I think, back to you, Sarah.
Correct. Thank you so much, Trent. Next, we will have Dr. Burrell, the Associate Chief Medical Officer of Accolade, to share more about return to work and the mental health gap. Greg, thanks again for being with us. Over to you.
Great. Thanks so much. Thanks so much, Dr. Hallberg, and Trent. Thank you. It's wonderful to hear you talk through some of these things. It's really exciting work. I love to hear it every time. So it's really very exciting to me. And thank you so much for having me. If you would like to just move to the next slide, I'll talk through a little bit about some of the statistics that many of you will know. I would say, even many of you will have lived these, as you see, some like 85% of folks who have parents who have at least one child remote learning from home. Many of you have lived and experienced that, in a way that has been an extreme challenge in certain times. And so I'll talk through some of those statistics and then, also continue to elaborate a little bit on how the effect that this has had and where we all as a society, as healthcare providers, as employers can, as benefits buyers can think about where to go from here. And so really some really significant, frightening, and sometimes and just really amazing statistics that are out there. 4 in 10, 40% of Americans know somebody who has been either hospitalized or passed away from COVID. Really a very terrible and traumatic, but a statistic out there. But I think most people can identify that that nearly half of us do know somebody in that group. Huge effects on the labor market. A quarter of folks say that themselves or somebody in their household was laid off. And it was incredibly uneven. Certain things like anybody in hospitality or entertainment or things like that, certainly were had challenges, significant challenges, and significant drop in revenue in the way that they do business. Nearly over a fifth, nearly a quarter of people. So many people started working from home. That number probably is nearly is up in the 70s or 80s for people that worked from home at some point if they were able to. But this is saying that actually folks that started a new position remotely and just started it from home, and so showed up on day one of the job and potentially still or up until very recently were continuing to just work from home, and so had not had the chance to have an in-person meeting with coworkers, had just been purely remote. And no surprise that 2/3 of Americans have reported having less social interaction since the pandemic began. So if you'd like to go to the next slide. I think that one thing that I would like to kind of mention here is, really the reality of kind of the way that we do healthcare here in America is challenging in the sense that employers in many ways are asked to do quite a bit, and oftentimes the main things that employers are doing is running their business, which might be in an entirely different industry than healthcare, and they do want to do everything they can to keep their employees happy and healthy, but sometimes the right answer in front of them is not always obvious. And over time, I think employers have become more and more savvy about these things as they've needed to be. But certainly, I would say that such a huge and unexpected and drastic change can knock people off of that course that they were on, and so it can be challenging to some are struggling to be able to address the new needs that are coming up, and so you've clearly seen some definite changes in focus, and mental health is really one of those huge increases in need that we think is still relevant, that we absolutely think is still relevant. It's still high. We can talk about the reasons why in a moment, but certainly, I think that when surveys have talked with workers, that a number of people feel like they're still hoping for more. They're still hoping that their employers could be doing a bit more to support them in their journey at this time, and some are feeling like there's not much of anything out there for them, and they're a little bit left out on their own about it. And so, really, I think we've been talking with a lot of companies about how to avoid being in that group, and how to be really feeling like you're addressing this from multiple different angles and from all sides. And so that's the way that that's what we've been hearing out in the marketplace these days. I think that the challenge and the challenge out there and the cost of not addressing this head on, is very significant. And of course, in general, you have both kind of direct and indirect costs that can that can result from this. One of the biggest areas that we see is in folks who have a chronic mental health condition as well as a chronic physical health condition, that if their mental health condition is not doing well, is not well controlled, then the chronic physical conditions will also suffer, and they'll have challenges with that, and the kind of care may become ineffective for those, and so you're looking at a significant increase in healthcare costs for those. Those can be things like ER visits and inpatient stays, and a higher set of medications because, or higher cost set of medications because the control is not there. And so you can certainly look at things like that. And then, there's the indirect costs and as well, which, certainly have been talked about before, but things like lost productivity. And so just kind of somebody who may need to have more breaks per day, or more days off, or more sick days, or things like that, because they're struggling with a mental health condition, or other kind of psychosocial reasons that they are having troubles at home. And so things like anxiety can lead to a pretty astounding number of lost work days per month. So 4.6 out of an average of 22 to 23 work days per month. Pretty significant. And in places where employees feel like they're not being adequately supported, you certainly have attrition, and folks will feel like they're not being adequately supported, may start to look elsewhere. So I apologize. That was that's the bad news. That was all the tough news and all the challenging stats. So what can we do about it? And so where can we go with this? And so really our approach has been to really think about this from whole person care. And that the market has seen a lot of point solutions, and some of those are really excellent, but they need to be kind of coupled together in a way that makes this whole person really support the mind and the body as one, support those physical health conditions like diabetes, asthma, high blood pressure, things like that. But really, in addition, make sure that collaboratively and in an integrated fashion that you're supporting the mental health as well. So that proactivity is crucial. Really elevating mental health into the discussion with your employees, acknowledging that it is out there, acknowledging that this is something that folks are struggling with. Really building that awareness around the benefits that do exist, things like EAP and therapy and other benefits that may already exist within your system. Really kind of using a set of data to stratify and to say which groups are the ones that we think may need this, which ones. So of course the ones that have a known diagnosis, but what about folks that might be out there with a diagnosis that's not known yet? How can we use other data points that might be out there to help determine that? Really making access just easy and straightforward is such a crucial step. Making it so that there's not a wait list to get to your therapist, that there's not hoops in terms of network and coverage and out of pockets and complicated things to traverse. Really just making that access to mental health care available is a huge point here, and helping them understand that kind of journey. And then we think really kind of taking that and kind of complementing it with a really comprehensive approach. So thinking about how you relate it to other things that are going on in their life, like their diabetes, their asthma or COPD, things like that, and embracing kind of collaborative care solutions that we know from years of working with them, they work, that they have an ROI that's very positive and works for people. So with that, I think I'll pass it back to Dr. Hallberg.
Yes, thank you so much, Dr. Burrell. I know this pandemic really has made us go and focus much more on the whole person, such an incredibly important thing as we move here back to work. And now I would like to introduce Nathan Gregory, the Associate Director of Human Resource at the City of Fort Worth, as he shares a case study of how he was able to reverse diabetes and deprescribe medications in his employee population by leveraging the Virta and Accolade partnership model. Basically, how does this work? What does it look like when it does? Nathan, thanks for joining us today. Over to you.
All right, well, thanks for having me. Again, everyone, my name is Nathan Gregory. I oversee the City of Fort Worth's wellness and benefit strategy. Just a little bit about the City of Fort Worth. We provide benefits to over 11,000 members. We're home to getting close to 1 million residents and growing very, very quickly. We just moved up to the 12th largest city in the country, and we're one of the fastest growing cities in the country. So lots of people moving here to Texas, and therefore our population is continuing to grow. And what that means for us as a city is that we have to continue to add workers in order to provide good services to our citizens. So this webinar, it's about chronic care and return to work, and I'm excited to share that the City of Fort Worth success story. I mean, historically, diabetes has been a big challenge for us and for our population, but I believe by providing high quality telemedicine to our employees, that it's been one of the best ways to support them through the COVID situation, through the pandemic, and then of course through the transition back to the office. We have employees from all different walks of life here at the City of Fort Worth. So obviously we have civil service employees, police and fire. We have water and street employees, those that kind of work in the field, and then we have employees that work in the office place. And so it's a very wide mix of type of employees that we have and that we support. And diabetes has been our largest disease state for years here at the City of Fort Worth. And so I'm excited. That's why we started the partnership we started with Accolade and with Virta over the last year during the pandemic. And so I'm kind of excited to share kind of what's happened so far with us. Next slide. What we've seen are really groundbreaking health improvements in our population. And so what I want to really emphasize is that these are happening in tandem. The City of Fort Worth patients are achieving glycemic control and 10 pounds at least of weight loss while simultaneously eliminating 40% of their medications. So medication deprescription is the Virta differentiator. For most patients, type 2 diabetes meant a life sentence of insulin injections, costly to them. But now with diabetes reversal, we're seeing it's possible to move off of drugs and maintain that control over their glycemic lives at the same time. Next slide. So let's start with a before and an after snapshot. The top bar is a snapshot of what our population looked like before Virta. This is what motivated us to seek out help, because when you see this trend persist over time, you know that it's a problem, and you see your sickest employees continuing to struggle with this condition, and so you start to wonder, what's the best solution out there, and is there a better way to go about caring for our employees? And just 1 year of being on Virta, we were able to increase our patients' sub-diabetic A1C by 3 times. So take a look at the changes in the green bar and in the red bar. Next slide. So health improvements and RX reduction is a main driver of our cost savings. What we're seeing in this chart is how much of a reduction there has been in insulin for patients who have been on Virta for 120 days. The results are pretty dramatic. In fact, we were able to reduce the amount of insulin prescribed by 43%. And for diabetes medication broadly, 40% of diabetes medications were eliminated, and 25% of City of Fort Worth patients on diabetes meds at baseline are no longer on any diabetes meds at 120 days. So this happens naturally when patients are becoming healthier, dropping their blood glucose levels. They no longer need medications anymore. Not every line here is at 0% and may not be in the future either. This is because clinically it may be necessary for some patients to, for example, continue taking insulin because their bodies need it. So while Virta clinicians may not entirely deprescribe it, in the majority of cases, they are reducing the dosage patients are taking. Next slide. So we're getting great feedback about Virta from our members. If you are a benefits manager or benefits administrator at your organization, you know that typically no news is good news. And so when you actually get good news and when you actually get positive reports back, you know that something is going really, really well. So just one quote to read here is, being diagnosed and learning to live with type 2 diabetes is something that has changed my life immensely, not for the better. Knowing that there is a program out there that can help me address the root cause of the problem and even possibly reverse this disease has given me hope that my quality of life can improve. Thank you for providing this opportunity for change. I don't know about you, but you can't buy that, right? You can't, that's amazing feedback. When you get that kind of positive feedback. And just one other instance to share, earlier this week, a couple of us were presenting to retirees. Yes, we even have some pre-65, pre-Medicare retirees on our health plan still. And we were presenting to them, and we started to talk about Virta. And before we could even get started with it, two of our retirees raised their hands and said, I love it. It's been great for me. I've lost this much weight. I'm feeling so much better. I mean, I was ready to pull out my pocketbook and hand them a 20 or something, because amazing to get that kind of positive feedback. So these are just some of the success stories that we've heard from our members. We're in the process of interviewing a few of our members, and we'll be publishing individual testimonials soon. So thank you, and I'm looking forward to sharing more about our return to work strategy here at the city during our panel discussion. Turn it back to you.
Thank you so much, Nathan. Can I have all the panelists turn on their video cameras and come off mute for the live Q&A session, please? Thanks so much. So I am going to start out with this question. Benefit leaders have found it challenging to navigate the wealth of digital health point solutions. What is your POV on digital health platform solutions and the advantages, disadvantages of everything stores when creating a comprehensive care plan? And I think, Nathan, that probably first goes back to you, but I'd love anyone else's input as well if they'd like to contribute.
Sure. Well, it's a challenge, right? There are so many options out there. There's so many solutions to look at, and then of course there's more of the everything stores, maybe like a Teladoc or such. We see that there's a need for it all, and the challenge with that, however, is how do you keep your health plan from getting too complex, too complicated, that your members can't figure out what solutions to go to and when and that sort of thing. And so what we've had to do is take a really strategic approach. And I mean, first of all, our approach has been, we talk to anybody and everybody out there, all solutions, to try to get a feel for what they're doing and and then try to make a determination as to what's gonna fit best for our members. And we think that whether it's more of an everything store or whether it's more of a single point solution, we think that we need both in order for our members. But we also have to be very mindful to pick the best solutions, but also to make sure that we're being very specific and targeted about what solutions we choose. And so we take a look at our data, our claims data, our members' data, to make sure that we are being targeted into which solutions we're going for first, how we're marketing those to our members, making sure not to do too much at the same time, too much marketing at the same time to confuse our members, but kind of roll one thing out at a time so that we can really get that in front of the appropriate members that we need to in our population. So that's kind of a couple of thoughts for us. We think that it's all good, and we'd love to roll it everything out at the same time and just get it out there, but we have to be really picky and really choosy as to how we do that and when.
All right. Dr. Burrell, do you have anything to add to that one?
Sure. You know, I think that I certainly agree with a lot of those points, and I know that we hear that quite a bit about really how there are a lot of options out there, and I think that the balance that I think is that companies are working on, and the balance of where to go on this is, you really want high quality solutions. And so you really want to go to somewhere that really feels like they're really moving the needle on health. I think Virta is a great example of that in the diabetes space. But then you want to be able to integrate them with the rest of your solutions in a way that's going to move the needle on health, and that doesn't have a number of siloed point solutions out there that becomes complicated for your employees to navigate and to be able to figure out which ones to go to and which one's the right one for me at this time. And so, we really feel like while there's a clear value for looking at and evaluating and seeing the best kind of point solution, and that has a lot of value, that you want to be able to make sure that those are cohesive, that those are able to help the employees get to them, get the most benefit from them, and of course, as we were just talking about, the body's one thing. These different things kind of talk to each other. They have they have to work together. Getting medications from one place versus 7 is obviously preferred, meaning that your pharmacy should understand all of the different medicines that you're getting, things like that. And so I think that there needs to be that glue that helps these solutions stick together and understand that whole person and where they go.
The needs are really great right now. It's just keeping the complication down for patients and employees so that they can access it all, is what I'm hearing. I thank you so much. What about chronic care make care delivery and care quality uniquely challenging? What are some gaps that are often overlooked in mental health and diabetes care platforms that benefit leaders should be mindful of?
So, chronic care, first of all, it's hard, right? So a lot of times there can be comorbidities involved, and so it can be very, very challenging. I think that what you just saw earlier in this webinar, I think it's important that, especially when you're talking about diabetes as an example, that you do consider the mental health component to that, and the depression, and the additional things that can come along with that, and the disparities that exist in the healthcare system. There's so much to take into account. Very, very challenging. And the only thing that I can say is that as benefits leaders, that we recognize it, that we talk about it, that we talk to our members about it, that we get feedback about it, and that we make the best decisions that we possibly can for our members.
I would definitely echo that. It is hard, and I think that's why that it is one of the ones that why some of the traditional knowledge has been kind of either focus on a niche, or either do something where the patients come to you, and or where it's kind of some of the payment models may not necessarily be focused on outcomes and things like that. And so, because it is hard, and so it's really, but that's also why it's important, is because it, a lot of these things for that patients and employees and their families are going through, like that, they kind of, you have to get all of them, or at least nearly all of them, really in place for the health to get better. They have to be able to make it to appointments, and if they're virtual, that solves one thing. They have to be able to afford their medications. They have to understand why they take them in a way that they'll do that. They have to have somewhere they can go in between appointments if they're having questions. It can't just be kind of 10 minutes every 3 months and then see you later for 90 days. So I think you have to really fit together a system that really supports somebody on a daily basis as they need it.
I would also agree, especially on the comorbidities. And then it's really hard to understand the benefits that are available. We're in the business. It's sometimes difficult to understand what you're able to get, which I think really Accolade can help with. care delivery aspect of that question is also difficult, especially now. And we saw it last year emphasized, but high risk people that are watching the television and they're hearing about not only the comorbidities, but the correlation with death rates and complications with COVID-19, they need care remote. It's not just about monitoring remote, but they need physician care remote. And that's what was a really important element last year that I think will continue this year and a few to follow. So that was 3 answers to one question. If you have others, Shannon or Dr. Hallberg.
Yeah, I think that one thing we can all say that everyone, including everyone on this call, agrees with is that this is really tough. And this is why we're talking about it. These are really complex problems. But I think that, over the last year, we can all agree that the importance of making sure that everybody's individual needs are addressed in a way that's best for them is definitely the way moving forward. And I don't think we are going to be going back to the way things weren't working out as well. And we're going to continuing to be pushing to look for new solutions, which is really exciting. So this question goes out to any of the 3 of you. Some fear that the return to work transition may exacerbate health disparities for vulnerable groups even further. What are some of the ways you would encourage adjusting return to work policies to support the vulnerable groups during the transition?
I can start. For our population, and I think for every population of members out there, for every organization, the key is flexibility. We have to accept that not all solutions are going to work for all members. We have to accept that there's not a one-size-fits-all approach to return to work. We have to talk to and listen to our employees and our members and hear what they're having to say and where their concerns are and where their struggles are. We have to recognize that we cannot create policy in a vacuum. And as a human resources professional, if there's any others listening to this in the human resources profession, you realize that that happens too much of the time. Policies get created that we think will fit for 85, 90% or whatever of the population. And yet there's 10, 15, 20, sometimes more % of the population that doesn't work for. And so we have to be strategic with that. And but anyway, I'll get off my soapbox on that, but we have to be flexible and just realize that we have to talk to and listen to our people and to our members.
Can I add on to that if I may too? So we've talked a lot about employees and obviously they're critical in this scenario here in discussion. But as we think about the return to work now impacting other members of the family as well, who needs also should be addressed to ensure, a continued productive workforce. And so I'm just curious for any of you, as we think about the employees, what other members of the family and considerations do we need to make?
Absolutely. I was just thinking the same thing, Dr. Hallberg. And so, I think there's lots of, just like Nathan was saying, there's, the flexibility is key. There may be some folks who, are starting to go back to the office, but their child maybe isn't back in school yet, or the daycare is not open. And so they have to figure out how to balance that, or they have a partner who hasn't been able to find, a replacement position or something like that. So lots of complex scenarios that, maybe were much less common or didn't exist at all in 2019. And so really have to think about how that's done. And I think that one of the biggest things that we've been really advocating and really feeling like is just making it very clear the different variety of things that are available, making the access to those benefits and those programs very easy, making the access, just super easy, and giving people multiple modalities to be able to do that. So let's say that it's a flu shot. It could be at the office. It could be at a community center, or a COVID vaccine in that case. That it could be, or that care could be as much as humanly possible is available virtual as well. And so you're really giving people the options, so that they have that available, and that the access is very easy for it.
One of the things that we've learned, or I think not really learned, I think everyone realizes that the average person out there, I mean, we are professionals in this business, right? The average person out there doesn't pay attention necessarily to their healthcare until they need healthcare, until they have an issue. And so we've discovered in our profession, at least, that we can communicate, and until someone actually has the need, that communication doesn't do any good. So we're essentially communicating for when the need occurs. And I agree, we need simple solutions to be able to provide access for all members of the family that are on our health plan, not just the employee. And as far as return to work, it's as we sit here on July 15th, we don't know for sure where things are going to be at in the next month, 2 months. Are schools going to completely reopen? Are the other member of the family, are they working? Are they working from home? What will, how will their lives look and change even as we move on into the fall of this? So it's an interesting time, ever changing, and we have to be there to help our members, help our employees, but also help all members of the family as their needs come up.
Nathan, if I could bounce one more back to you, which is there an incentive built in for participants participating in the program?
In Virta?
Correct.
And not an incentive per se, but we've made it very, very simple and very, very easy for them and to participate in the program. And very, very, we have pushed it heavily, and we have continued to communicate out the success stories. So for our population, incentives sometimes work, sometimes don't, many times don't work because it's all about, for our particular population, maybe we're unique, I don't know, it's about word of mouth, and it's about hearing about other members and their successes. Our population is slow to accept change. And so when we roll out new programs and new things, we always say that it's a 3-year process because our members are, especially when you're dealing with law enforcement, fire employees and things, they are typically in that profession for life, right? And so they are long-term employees. And so when we roll something out, it's very important to realize that it's typically not a super fast thing that everyone takes advantage of. They want to hear from others about the results. So we focus more in on that rather than a pure incentive to be in the program. Like I say, we've had some incredible success stories to be able to share. And so we're just continuing to push those out on purpose where we're able to, but then we're okay with the word of mouth and just letting that kind of trickle out throughout the organization. And we think in the long run, that's going to propel the program forward.
Great. Well, we're coming to the end of the hour, and I want to take a minute to once again thank our wonderful panel here with some great information and a lot of things to consider as we move forward to the next phase, let's call it, of the new workforce. So thank you, Nathan. Thank you, Trent, and thank you, Dr. Burrell, for your wonderful contributions today. Once again, I did want to remind everyone that this recording will be sent to everyone afterwards. And so look for that in your inbox. Thanks, everyone, and have a wonderful afternoon.
Thank you, everyone.